Hello, my name is Kaylee Marston. I'm a speech language pathologist at Living Cancer Institute in the Department of Supportive Oncology. Today, in honor of Dysphagia Awareness Month, which is in June, I want to talk to you guys about what dysphagia or swallowing impairment is, particularly in the oncology population, and also how to talk to your doctor about these concerns. So what is dysphagia? Dysphagia is a fancy term for an impairment in swallow function, and it can involve the oral cavity, the pharynx, and/or the esophagus. It can be an impairment in any one of these or multiple of these areas. Swallowing is a really complex process and includes over 20 muscles and nerves that have to work in a very synchronized and coordinated manner. And so any impairment or difficulty during this process or in multiple parts of the process can lead to dysphagia. This affects more than 15 million Americans, and over 1 million Americans receive a new diagnosis of dysphagia each year. What are some causes of dysphagia? Well, some common causes that you may hear of would include stroke, traumatic brain injury, and other progressive or degenerative diseases such as dementia. But in oncology, some common causes include cancers or tumors of the oral cavity, the pharynx, the nasopharynx, the esophagus. Someone can also have dysphagia or swallowing impairment following surgical resection of any tumors involving the head and neck, because they affect the movement or performance of these structures. So for instance, if someone has a tumor and then has to have part of their tongue removed, you can imagine that that would make swallowing more difficult and would lead to a dysphagia. Cancer treatments such as radiation to the head and neck can also cause a swallowing impairment, which we're going to talk more about. But you also can have dysphagia from lesions or tumors of the brain. For instance, if there is a tumor involving the cerebellum, which helps with coordination of the swallow, this would likely lead to a dysphagia or a swallowing impairment. There's numerous associated factors that go along with having a swallowing difficulty, and that can include or be exacerbated by things like side effects from medication, someone who has an infectious disease that's affecting their swallow, or their swallowing impairment is also leading to infectious disease. That's why it's an associated factor. Dysphagia can commonly occur following cardiothoracic surgery due to damage of usually one of the nerves that involves our vocal cords and protection of our airway. Reflux is also very commonly seen and associated with swallowing impairment as well, and just general frailty or decreased nutrition. So what are some consequences or results of having a dysphagia or having swallowing impairment? Well, of course, it can cause discomfort and pain or irritation when eating or drinking. And overall, if you're having a really hard time with swallowing and thus eating and drinking, it really can have a negative impact on someone's quality of life. If you think about how much eating is a part of our life, when this is difficult, this really can affect someone's mood and just their overall sort of participation. Maybe they're not going out to meals very often and thus not enjoying maybe some time with friends and family, etc. So it can really sort of carry over into many parts of their life. Aspiration pneumonia can be a consequence of having a swallowing impairment because it affects the lungs and thus can lead to significant illness. This is different than other types of pneumonia, and so it is important that we distinguish between aspiration pneumonia and something like community-acquired pneumonia. Having a swallowing impairment can also just affect someone's overall general health. If they are malnutritioned or dehydrated, of course, this is going to affect their whole body and just their ability to function. Choking is less common, but is definitely seen in those that have a swallowing impairment because they're not protecting their airway as well, and food is more likely to go down the wrong way, maybe compared to the average person. So what are some signs or symptoms of dysphagia? How do you know if yourself or maybe a loved one may have an impairment in their swallow? We're going to talk about what are some overt signs and symptoms, so things that are much more obvious or that you can hear or see, and then some that you can't necessarily, but are indicators that there could be a swallowing problem. Coughing or throat clearing during meals can indicate that things are going down the wrong way because our body's response to things going down our airway instead of our esophagus is often to cough or throat clear. However, it's important to distinguish that if this is happening more while you eat and drink versus coughing for other reasons, such as having congestion or, a lung infection or something like that. So if after you take a sip, you tend to cough very frequently, that could be an indicator that something is off with your swallow. Of course, all of us experience this from time to time where we feel something go down the wrong way, but this is really if it's happening frequently. Wet or gurgly vocal quality can also indicate that things are going towards the airway near the vocal cords instead of down the esophagus. Facial grimacing is often seen when people are experiencing pain or discomfort with their swallow. So for instance, patients who are undergoing head and neck cancer and are in the middle of radiation treatment often see that their pain level is higher when they go to try to swallow because of the way the treatment is affecting their tissues and the pain it could be causing. And so they may be really facial grimacing. If food, or in particular more likely liquid, comes out of your nose, that is called nasal regurgitation. And of course, it's going the wrong way. We want it to go down our esophagus. That could be an indicator that something is off with the swallow and would need to be assessed. A lot of people will complain that they feel food sort of stuck in their throat. This is different than choking, where you cannot breathe, but instead it feels stuck in there like you have to swallow numerous times to get it down. And again, this could be an indicator that there is something wrong with the swallow. When people need a lot of extra time to chew or swallow, and in particularly complete an entire meal, we're talking 30 plus minutes, 45, an hour, not including if you go out to eat, you may be talking, or there may be time in between getting your appetizer versus your meal. We're talking more just if you're focusing on eating a meal and it's taking you, an hour to eat something, that's definitely an indication that something could be off with the swallow, and we would want to assess that because it can have a negative effect on our digestion. Now, something that's not as clear cut or noticeable on the day-to-day could be if you're diagnosed with aspiration pneumonia, even if you didn't have any coughing or throat clearing with eating and drinking. Because sometimes these things can happen silently, which means our body is not sensing that things are going down the wrong way. But unfortunately, it can lead to an infection in the lung and a result aspiration pneumonia. Weight loss, malnutrition, dehydration, again, these are indicators that, we are maybe not getting enough food down the right place, and thus a result could be weight loss or malnutrition. It should be noted that particularly in cancer, there can be a lot of reasons for weight loss, malnutrition, and dehydration that are not specifically due to a true swallowing impairment, which is why we are just one of many people who work within a multidisciplinary team to really address these signs and symptoms within patients and really figure out the underlying cause. So how do you discuss these concerns with your doctor? I think it's helpful to think about WH words like our who, what, where, when, whys. So in terms of what, it can be useful to specifically describe what your symptoms or what the signs are that you or maybe your loved one may have a swallowing impairment. For instance, are you noticing coughing and throat clearing when you eat and drink? Is your voice sound really gurgly and wet throughout a meal? Is it taking you a long time to finish a meal? In terms of where, you want to think about where you are observing the difficulty, and maybe there's more than one area. Is it when you're trying to prepare the food in your mouth? Is it towards the back of your mouth into your throat? Is it after you've already swallowed and you feel it sort of stuck somewhere? So these specifics can help not only your doctor figure out what may be going on, but also then if you're referred to a speech language pathologist like myself, that really helps us start to dive into what's going on. You also want to talk about when you first started noticing these symptoms. When did they start occurring? Was it after a procedure or after a certain cancer treatment or after a certain diagnosis? Do you notice if it's happening during certain times of the day, maybe in the morning versus later in the evening? Is it during certain meals or certain types of foods? Again, these specifics are very useful. The why is always the harder part, and this is really where your doctor and or other providers, such as speech language pathologists, for instance, can help figure out why these symptoms or why this dysphagia may be happening. But you still want to maybe share your thoughts about why you think it could be occurring and ask your doctor why they think this could be occurring. And of course, how we're going to address it. What's the next steps? So in terms of what's next, there are both additional providers and assessments that we can utilize to better figure out what and why you're having a swallowing impairment. Speech language pathologists, although our title does not describe it, we're actually trained in addressing the assessment and treatment of dysphagia. We have a lot of knowledge about the swallow, and this is a very key part of our job, particularly here at the Levine Cancer Institute. We utilize some sort of gold standard assessment tools, things like a modified barium swallow study, which is an x-ray of your swallow. You eat and drink different consistencies of barium. We watch it on the x-ray machine while also giving you different posture changes or trying different strategies to see if they improve like the safety, the efficiency of your swallow. A fiber optic endoscopic evaluation of your swallow, or more commonly known as FEES, may be performed where we take a scope and run it. It's a very small scope, run through your nose to the back of your oral cavity. And we have a bird's eye view of your larynx where you'll see vocal cords, an epiglottis, a pharyngeal wall. And you eat and drink different consistencies that we digest with food coloring, usually green or blue. And we watch it up on a big TV screen monitor, and we can get a really good picture of sort of not only what your structures look like and how they're moving, but also where food and liquid is going. And again, we often try different strategies or head positionings to see if anything helps. You may be sort of prescribed swallowing exercises or recommendations for compensatory strategies and posture changes, or even food modifications such as thickening liquids or avoiding certain consistencies. This will always, be directed by speech language pathologists, but we work very closely and are very lucky to work closely here at LCI with registered dietitians. They help us implement these strategies for our patients and monitor them appropriately. So I hope that explains a little bit more about what dysphagia is, or what a swallowing impairment is, how it can affect the oncology population, and how you should talk to your doctor about it. Please feel free to leave questions, comments, and if you want more information on dysphagia so that we can provide additional videos in the future, please subscribe and follow our Levine Cancer Institute Department of Supportive Oncology YouTube channel, and thank you very much.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.